This is Dr. Lam from drlam.com. Today we're going to talk about the role testosterone play in the male. Now, low testosterone syndrome, that is quite popular nowadays, is an approach to anti-aging and vitality by giving male testosterone when it is considered low. Well, the question, first of all, is what is considered low testosterone? Now, one can do a laboratory test and measure free testosterone, and there's a laboratory reference range. If it is low, then physicians may start the patient, in the case of male usually, on testosterone. And the purpose is to ramp up the metabolic rate, to increase energy production, reduce fatigue, and give an overall sense of well-being. Libido usually will go up as well. In such case, normally the initial progression is one of clinical success. In other words, most people do feel better with testosterone, and rightfully so, because that is the intent, and testosterone is doing its effect. The problem comes is when you have either excessive testosterone or you develop tolerance to testosterone, and this can happen over time because the body has numerous hormonal feedback loops, and when testosterone, which is normally made in the adrenal glands, as well as the male gonads, are being replaced externally, then there oftentimes can be a downregulation as well as a lowered testosterone output intrinsically. Now, this may not be evident in the short term, but oftentimes over time, this can be problematic. So excessive testosterone from external sources, such as from testosterone pellets, creams, and oral testosterone can be helpful to help adrenal fatigue recover. But normally, we try to stay away from that unless there's absolutely no choice, because while it gives you a temporary boost, the long-term problem is significant. And if you do have problems in terms of dependency, withdrawals, and resistance develop, then over time, then the testosterone level may be able to increase back to normal only with an ever-increasing dose. Now, this is problematic, especially if you can have other sensitivities, and the testosterone may lead to a state of being wired and tired. And in other words, testosterone keeps you excited, keep your mind alert, keep your metabolism high. So automatically, you're going to be more energized, and you will be wired to a certain degree. People will experience the energy increase, but somehow it's not quite natural. It is somewhat hyped or artificial. And excuse me. And this can be problematic, not necessarily in the beginning, but usually it's a long-term problem. The problem is that when you come to this point, what do you do? Now, those with adrenal fatigue is particularly vulnerable because when the body is stimulated with testosterone, usually other compounds may also be on board, such as thyroid, herbal, as well as glandular products that people commonly use. And when you combine all these metabolism into the body and stimulate the system, then the bodies become more and more excitatory with each day. And this oftentimes can have long-term masking effect because the underlying root problem may not be resolved, while on the surface, things seems to be quite doing well until major stressors come along. And that's the time that body is under tremendous stress. More testosterone is necessary, which can cause us a crash. Or if you stop the testosterone abruptly, it can also cause us withdrawal. So, unfortunately, the ending for testosterone, especially when it's high amount over time, consistently, can have many, many negative ramifications. And you have to be very, very careful. Fortunately, there are many alternatives that one can use to consider instead of testosterone. So testosterone we can consider as more or less a last resort, but at the meantime, do consult your adrenal fatigue literate practitioner and get onto a program that's much more gentle that can effect the same clinical outcome without the risk. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.